In celebration of International Hearing Day, which is on the 3rd of March, World Health Organization launched a report to raise awareness about the global action needed. The slogan for this year, Hearing Care for All, Screen, Rehabilitate, Communicate. This is Haifa Al-Hajjaj, clinical audiologist working in BAHA. In this lecture, both I and Dr. Jose Fayad hoping to shed some light on hearing problems, how to protect your hearing, and surgical and rehabilitative options. And hopefully we'll be answering some questions that are lingering in our minds. I hope you find it useful, and we thank BAHA for organizing such an interesting event. And this is our first probably virtual experience launching some important knowledge that we'd like to share with everyone. I'm gonna hand over to Dr. Fayad to speak to you for a bit about some surgical options, and then wait until you join me for more answers and questions.
Thank you, Haifa, for this nice introduction. I'm Dr. Jose Fayad, and I'm in here to talk about the rehabilitation of hearing loss and explain some of the surgical solutions to some of the problems that we encounter in hearing loss. So first of all, I would like to start with a picture of the anatomy. So what you see here, you see the ear, this is the pinna, and then you have the area of the outer ear canal. You can see here the tympanic membrane, which is vibrating. The sound comes like this, moves the tympanic membranes, and then we have three bones of hearing. It moves the bones of hearing. All this information and energy will get pushed into the inner ear where the fluids are, and then the information will go to the brain via the hearing nerve. So I want to show you what normal looking tympanic membrane is like. Basically, with every patient that is complaining of hearing loss, we start by examining the ear under the microscope. And you see here a normal tympanic membrane. You can see it's transparent. Through the tympanic membrane, we can see some of the bones of hearing. This is the handle of the malleus, and this is the incus. And you can see that the middle ear cleft is clean, and the tympanic membrane is nice and transparent. And this is what we call the cone of light. When we see it, it means that everything looks pretty good. Also, before making any decisions about surgery, we have to get a very good and a very accurate hearing test. You see in here a hearing test done by one of our audiologists. Typically, everything in red basically is testing the right ear, and the blue is we are testing, the left ear. On this hearing test, we test frequencies from 250 to 8 kilohertz. These are the low frequencies, and over here we have the higher frequencies. And for hearing to be normal, basically we like to have all these dots above the line of 25. Everything that's above the line of 25 is considered normal. So in this case, the right ear is completely normal, but on the left side, we have a profound hearing loss. We have a big problem in this left ear. Let me outline for you some of the problems that we can encounter in different parts of the ear. First of all, we will talk about the pathology of the external auditory canal. As we said, this is the pinna, and this is the area of the external auditory canal leading to the tympanic membrane. So problems in this portion of the ear can create a conductive hearing loss. We can have a big piece of wax in here that's blocking the area of the external auditory canal. We can have this bone in here grow and close the ear canal. This happens in people who swim in cold water. Sometimes you can have infection of the skin of the external auditory canal, and this will close completely the external auditory canal, and the patient will come in with pain and complaining also of hearing loss. And even we can have tumors that can arise within this area from the skin and block the area of the external auditory canal. Here are some examples. I just showed you a normal tympanic membrane. Here you have bone growth, and as you can see, this bone growth has closed completely the area of the external auditory canal. This is a patient who suffered from ear infections. If water gets in here, it will create like an infection which is very painful, and also the patient will be complaining of hearing loss because the sound cannot get to the tympanic membrane. This is another patient with a big piece of wax. Wax can occlude completely the area of the external auditory canal and create a conductive hearing loss. And this is another patient with what we call a furuncle of the skin of the external auditory canal, blocking the area of the external auditory canal and giving the patient also hearing loss. We can have problems now in the middle ear. The middle ear is this space here, where you can see it comprises the area of the tympanic membrane and the bones of hearing, the malleus, the incus, and the stapes. So this is the area of the middle ear. It's filled with air, and it is connected to the nose via the station tube. So pathology of the middle ear can include infections. As you can see in here, tympanic membrane is bulging. This is pus behind tympanic membrane. That would be like a kid coming in with severe ear pain, fever, and also hearing loss. And if you look at the tympanic membrane, you can find it bulging and there is pus behind it. This is someone who has a cold. The middle ear space is filled with fluid and air, and the patient will feel congested and will have a feeling of blocked hearing. This is also conductive hearing losses because the vibration cannot get to the inner ear. And this is a solution in a kid for this previous problem. We drain the fluid and we put in a laryngotomy tube in order to ventilate the ear and let air get into the middle ear. And this way we reestablish the vibration of the eardrum, which is essential for normal hearing. Over here you can see another patient, but this time with a tympanic membrane perforation. It's a total tympanic membrane perforation. You can see the ossicles. This is the handle of the malleus. This is the incus. The stapes is over there. The middle ear space looks nice and clean, but the tympanic membrane is completely missing. And this is a patient that will require surgery to rebuild the eardrum. This is another patient with a partial tympanic membrane perforation as opposed to this one. Some of the eardrum is still there, but there is a posterior or a partial tympanic membrane perforation through which we can see the ossicles. This is also a patient who will need a patch, who will need a reconstruction of the eardrum. Here is a patient who has an infection that we call cholesteatoma. In Arabic, we call it susi, in the middle ear. And this infection will eat the bones of hearing, will destroy the tympanic membrane, and will create a conductive hearing loss. Now, there is also pathology within the inner ear. The inner ear starts here. Okay, we said that the sound comes like this, moves the eardrum, moves the bones of hearing. So this is the outer ear. This is the area of the middle ear. I need to go back. Yeah, so this is the area of the inner ear. So this vibration that's transmitted by the middle ear bones goes into the fluid of the inner ear, and then an electrical impulse will go to the nerves. So pathology of this portion of the ear, which is the inner ear, will create what we call a nerve loss, sensorineural hearing loss. In this type of hearing loss, we lose the hair cells, and pathologies such as a viral infection or a bacteria can create this kind of problem. We can also have another type of pathology which increases the pressure within the fluid of the inner ear, and that pathology will also lead to destruction of the hair cells and will impair the hearing mechanism and will create a sensorineural hearing loss. Some medication will destroy the hair cells within the inner ear and will create also sensorineural hearing loss. You can imagine also if you are in a car accident or a severe trauma, we can get fractures going through the ear, and this will destroy also the hearing mechanism, will destroy the hair cells, and also sometimes will cut the nerves. And we have also tumors that starts within the inner ear or will start on the nerve of hearing or the nerve of balance that will also create a profound hearing loss in the ear. So this is Here are some examples. This is what a normal inner ear would look like. We have 3 compartments, and we have membranes that create those 3 compartments, and the hair cells, they are sitting in here. So the space is filled with fluid. We have 2 different types of fluid, and once the hair cells move in here, an electrical impulse goes through the nerve. Here is the nerve, goes through the nerve to the cortex. Now, some pathologies, here you have an infection within the bone of the inner ear, and this bone will destroy the whole inner ear and will create a profound hearing loss. Sometimes you can get meningitis, and the bacterial infection or the viral infection will get into the inner ear, and instead of having a space that's filled with fluid and looks beautiful like here, we will have a space completely closed by new bone formation. You see, this is just the cochlea has been replaced by new bone formation. In this case, you have tumor that now is growing on the hearing nerve and on the balance nerve and is invading the cochlea and destroying the hearing in this case. So these will create what we call a nerve loss. This is very different from conductive loss. The conductive loss is can be repaired quite easier than the nerve loss. So based on our examination under the microscope and based on the results of the hearing test, we have pretty much 3 options. You know, basically we can offer observation. These are patients who have a minimal amount of hearing loss, and you know, we ask them to come back in 6 months or in 12 months. We repeat the hearing tests, we see if there is any progression, and we keep an eye on their hearing loss. There are other patients who can benefit from hearing aids, and you know, I'm most interested in surgeries for other issues, like issues happening in the middle ear, as we explained. You know, we will talk a little bit about cochlear implantation, about middle ear implant, and bone-anchored hearing aids. So in this picture, you see a bunch of hearing aids. You can see hearing aids can be very small and they can go into the ear canal, or they can be a little bit bigger and they can sit behind the pinna. Typically now hearing aids are becoming very light, and these are very sophisticated machines. You know, these are computers, and they can do, our audiologists, they can program them so they can give amplification where it's needed and provide the patient with higher resolution sound. The way a hearing aid works, hearing aids will amplify the sound and basically will shake the eardrum harder and would send more energy to the ossicles to the inner ear. And this is how we rehabilitate certain forms of hearing loss. Now, we will start talking now about some other options, which are surgeries to fix those problems. For example, you know, for problems of the middle ear, where the tympanic membrane is missing or the bones of hearing are missing, we do surgery for chronic otitis media. We open the ear from behind, or we can go also through the ear canal. We harvest tissue that will become the new eardrum. Then we have techniques of surgery in order to rebuild and reconstitute the eardrum. And you can see in here, you know, prosthesis. These are titanium prosthesis. When in certain pathologies, when the bones of hearing are missing, we will replace them using titanium prosthesis. In other cases, hydroxyapatite or some other material. But these are connections in order to replace the ossicles. Here you see 2 types of connections. Sometimes we lose the malleus and the incus, but we have the stapes still in position. So we will place a titanium prosthesis, a partial prosthesis. We place it on the stapes superstructure. We cover it with cartilage. And we cover it with cartilage. And this is the tympanic membrane graft. In some other cases, we have complete destruction of all the ossicles, and we go ahead and we place what we call a total prosthesis. We cover it also with cartilage so it doesn't extrude, and this is a tympanic membrane graft. So basically, we are able to reconstruct the tympanic membrane where it is absent. We use soft tissue, we use cartilage, and we use prosthesis. They can be partial, they can be total. In other cases, we have problems that we need to fix with different types of implant. In a case like this one, if we have a profound hearing loss on this side and we have a normal ear on the other side, we can place a titanium prosthesis into the bone, and then we can drive the titanium prosthesis to vibrate the bone and transmit the information, bypass basically the middle ear in this case, and transmit the information, to the other ear. And here you can see such a device. The titanium screw is placed into the bone, and you have here the processor, which will capture the sound, vibrate, send the vibration through the bone into the inner ear. These implants, they can be percutaneous, which means through the skin, like in this case, or they can be transcutaneous. The implant is placed under the skin, and then they communicate, the two pieces communicate together via magnets. This is another type of middle ear implant. You can see here a patient wearing what we call a processor behind the ear. This processor has a speaker, has a microphone, and has also a battery in it. It captures the sound, and then it communicates with the other piece, which is implanted under the skin via a magnet. And you can see here the titanium gold, and here titanium and gold placed over the assicular chain. So basically the sound that comes through the microphone will be transformed into a vibrational energy and will vibrate directly the ossicular chain. And this is what we call direct stimulation. A patient gets a high resolution sound. So this is what we call a middle ear implant. The implant is placed on the ossicular chain in this case. In other cases, we have what we call cochlear implants, and this is an example of a cochlear implant. Again, it's the same principle. This is the piece that we implant under the skin. Here is the electrode that will go into the inner ear, and this is the microphone. The microphone and the battery, they are housed in the processor, which will sit, over the ear. So this is the inside of the inner ear, and here we are inside the inner ear, and we basically will introduce the implant into the inner ear, and we wrap it around the nerve so we can deliver electrical stimulation directly to the nerve. Cochlear implantation requires a team of experts, including the audiologist, the speech therapist, the psychologist, a teacher or an educator of the deaf, social worker. Also, we need a coordinator for the program, and of course, the parents in cochlear implantation in children are the key part. They have to do pretty much all of this. And of course, the surgeon to place the device, but without the team, really the implant is just a piece of metal. So it is very important to have engaged parents. It's very important for the team to work together with the surgeon in order to deliver the best working cochlear implant for the patient to benefit from. So in conclusion, I want to say that there are different causes of hearing loss. We went through them quickly. We have to understand the cause of hearing loss and the amount of hearing loss that this is creating. And then we have to come up with a treatment, and we have to tailor the treatment to the problem. We have always to discuss all the options with the patient. I thank you very much, and I turn the table again, the microphone again to Haifa Al-Hajjaj, who will take it over from here. Thank you very much.
Thank you, Dr. Fred. This is probably a good time for you to go and get a cup of coffee, and I hope we didn't bore you so much with a lot of medical jargon. And I hope in the next section we can cover some information that's a bit more ordinary, that's going to touch everybody's everyday life. And questions that we get normally asked is, how popular is this problem? Why is it so important? In reality, luckily, the tumors that Dr. Fayyad was talking about, and these are rare things. What is more common is probably a child who will have a middle ear problem at home, who may not listen or hear. Sometimes they have ordinary hearing losses that can be recovered and get better, or permanent hearing losses. And also sometimes we have a teenager who's listening too much to a lot of loud music, or somebody who's working in the field and being exposed to a lot of noise, or in an airport or in a plant. And the same thing would apply. Maybe we'll have a mother or a father who's getting old, or maybe ourselves are getting old and losing our hearing slowly and gradually. So I'll talk you through that. According to the global statistics, there is 466 million people who suffer from hearing loss, which can affect life quality, of which 34 million children. In addition to that, a third of Earth population who are over 65 years old will suffer from 1 degree of a hearing loss. So the problem is actually very big. So with the limited time that we have, I'd like to go through some sort of more basic information that would probably clarify also Dr. Fayyad's slides. So I'll talk about which degree would we consider, and do hearing losses come in different levels? And the answer is yes, and we'll talk about that. What are the signs for hearing losses? How do you know that somebody has hearing loss, if it was a child or if it was an adult? What's the impact of that on somebody's life quality? How do we do that? If we get a child who is 1 day old, can we find out if that person has a hearing loss? And the answer is yes. So we'll tell you how we do that. And some of the causes of the hearing loss, some of the things that happen with the hearing loss, for example, something like tinnitus. Sometimes we have hearing losses that happen suddenly. There's also hearing losses that are induced by noise, as I talked earlier, and how we manage them, which would complement Dr. Fayyad's surgical explanations. So typically, we consider a normal hearing somebody who can hear whisper, somebody who can hear birds chirping, leaves, water dripping. That's considered normal hearing, which is what we have here. The unit for measuring hearing is decibel, which is, for example, when we say we measure weight with a kilogram, or height by using a meter. So the loudness of a sound is measured in decibel. So here we have the loudness scale. So a normal hearing is in this area, as I was talking earlier. And as the sound goes louder, so as the number gets louder in decibel, 30, 40, 50, it means that the sound is getting louder. So normal conversation level is probably around 55 decibels, and over 85 decibels is a level that causes somebody to have actually a hearing loss. So sometimes children would be able to talk and answer, but their speech is not quite clear. So that means that maybe there is an underlying hearing problem. So they might hear, but may not hear well enough. And that will be the job of an audiologist and a specialist that needs to come to the hospital to get that checked the same way we do with our eyes. What are the signs that we consider? For example, there would be different signs of course, for adults and for children. For adults, typically they would say, oh, I can hear very well, but people are mumbling. I can understand words, but like not when I'm in crowds and noisy places. Or when people are talking, I don't quite like, if there's few people talking, I can't hear them that well. And sometimes we ask people to speak louder or slower or more clearly. Sometimes we like the TV louder. Somebody in the house would say, oh, daddy likes TV really, really loud. And maybe there is a hearing loss that's going on there that he's not aware of. And usually other people would notice that. Or maybe he's trying to use the phone, but he doesn't like it except if it's on speaker because it would sound louder. And sometimes a hearing loss would be associated with ringing in the ears, or what we call tinnitus. For children, it's a different story because it's actually silent. A child who may have a hearing loss is not something that you would be able to notice immediately, because on the outside, that baby is going to look as cute as anything, and they interact as far as you're concerned, but maybe there's something that's going on there. So a child who is between, say, 0 to 4 months would normally startle if there is a loud sound. So maybe the vacuum cleaner is switched on or something. Normally that child should be able, for example, to wake up if there's a sudden high sound of that sort, okay? As they get older, there's other signs. The child would normally be calmed down if the mommy would be talking and he is not seeing her, or singing for him. And will start babbling, but if that child does not hear his own voice, so if he has a serious hearing problem, then they stop babbling. And then they don't use their voices to get our attention, or when we call them, they don't answer to their names. And as they get a bit older, say a year and a bit, normally a child will be able to say bye-bye and few words, and of course start talking. And if there's a delay, then we're a bit too late in diagnosing that child. Our game is always, our target is always to diagnose that baby as early as possible. And there's hearing screening programs, especially also in BAHA and other hospitals and internationally, where we identify babies before they even go home. What does that have to do with anything? Why hearing is such a problem? So obviously, if a child can't hear us, there would be a delay in his communication skills. He may not acquire speech and language like other children, and then he may have some learning problems. He may have poor academic achievement, and they might feel a bit socially isolated. They might have poor self-concept. And as we get older, also for adults, sometimes older people will start to feel a bit depressed, and it's also associated with dementia. So we have to be aware of, if an older person has a bit of a hearing loss, doesn't mean we just leave it and consider that as a normal thing that we have to live with, because there is actually solutions that could help that person stay integrated in society and have a better life quality. How do we do that? Most people would think that, oh, how do you diagnose the baby? Like for an adult, it's easy. It's what we consider subjective testing, because you put some headphones on, you put somebody in a quiet room, and every time they hear a sound, they answer, and then you can tell if they have a hearing problem or if they don't. For babies, it's a different story. So we have a full battery of tests that we do. We rely on what we call objective tests. So we connect that baby to some electrodes, and we get some information through the auditory nerve and the brainstem. And there's also a test where we get an echo coming from inside the cochlea, like Dr. Fayal was showing earlier. We also have tests that show us if the eardrum is moving well, if there's any fluids behind it. And also there's some tests that show us if there is the muscle in the middle ear is responding to loud sounds. So these are a sample of the tests. So there's tests that will check this area for us, the external part, and some tests for this part, which is the middle part, and some tests for the inner part of the testing. So this is, for example, the echo that comes from the cochlea. And this would be a normal montage for when we connect the child to do the auditory brainstem response test. So what causes hearing problems? Of course, genetics are a factor, but they're not the only one. And also there's aging, being exposed to noise, traumas to the head, some ototoxic medications, and also some congenital anomalies that some children are born with, and some syndromes and some diseases where a child might be born with that, or prone to some of these problems. So there is a relatively common problem, which is called sudden hearing loss. I'd like to talk about it because it's a personal problem. When somebody, for example, wakes up from a deep sleep and in the morning they feel a bit of fullness in their ears, ringing in the ear, and they ignore that, and maybe they go on with their day working, hoping that that fullness in the ear is going to go away. It's usually in one ear, and sometimes it's if that person does not go to the hospital as quickly as possible and ignore that, it's actually a problem that could be resolved but only if that patient comes to the hospital in the right time. So early treatment in some of the cases is very important. It's not something that we should ignore. Head to an emergency room because that's important. You can actually save your hearing by getting an early diagnosis. Tinnitus is a passion and close to my heart because of all the problems that it could cause to somebody, both psychologically, because it and of course physiologically. It's because the patient would hear ringing or roaring or buzzing or hissing in their ears, and they feel like they're literally going crazy. It actually happens to 10 to 15% of people, so it's relatively common. 10% would probably their brain will habituate to the sound and they will just get on with it and feel like maybe everybody hears that sound. It can be managed, it can be treated sometimes. Most of the time it's actually associated with a hearing loss, but the tinnitus did not cause the hearing loss, and it's better to get your hearing checked. And sometimes a hearing aid could help because once the brain gets the information that it needs as it expects to receive sound, most people would report back and say my tinnitus is actually better. Typical causes might be noise exposure, age-related hearing loss, sometimes some medications or diseases, and some problems are actually, some tinnitus cases, we don't know why they happen. And then it's always important to include that patient in an information package and counseling where they know how to cope with it and understand better that it actually sometimes causes some sleep disturbance and annoyance and concentration problems. So it's not something that can be necessarily, somebody could make it go away, but help is available. Noise-induced hearing loss is relatively common, and I think we're going to see in the future with these technologies and using headphones and listening to music at loud levels, and the word is sort of going crazy in terms of loudness. Everything is louder. So hearing loss could result from prolonged sudden exposure to loud noises or working in an environment over 85 decibels, like in factories and places and plants, and therefore it's important to use ear protection. The small hair cells in the cochlea that you saw earlier in the pictures actually get damaged with vibration, and therefore once those small hair cells damage, this causes permanent hearing loss, and then it becomes really hard to make that hearing get better. So the signs for noise-induced hearing loss are similar to the other sounds that we talked about. You hear a bit of that sound is muffled. People are talking, but maybe their voices are not very clear. Some ringing in the ears, difficulty hearing in background noises in restaurants and malls. Maybe trouble hearing some consonants like the S sound or sh, because these are high-pitched sounds, and also sometimes it's associated with this tinnitus that we're telling you about. The good news about it, it's actually preventable. I go with the 4 Ps. It's painless, it's permanent, it's progressive. So if you can do something about it, please do. If you work in a noisy environment, use your ear protections. If you can help your teenage child or young person in the house to lower the loudness, educate them, let them know that permanent exposure to loud noises could cause permanent hearing loss. So walk away from noisy places, turn down that volume, and wear ear protections. So what do we do about hearing loss management in general? So I'll sum it up. It's either medical or surgical intervention for problems like middle ear problems, infections, air conduction hearing aids, which the ones that we showed you in the previous slides in Dr. Fayyad's presentation. Sometimes bone conduction hearing aids, which means that the sound is going through the bone behind the ear. Cochlear implants, if none of the above works. And there's a lot of assistive listening devices as options in terms of helping somebody hear their TV better, etc., etc. Or maybe being in an environment where in a conference or in a meeting where they would like to hear just a bit louder because there is that background noise, etc. So there's some assistive listening devices as options for that. So what are the challenges? They are many. The most important for babies is early diagnosis and early referral, which takes us to the WHO screening advocation that's happening this year. So the earlier we diagnose that baby, the more that brain has the maximum plasticity to be able to explode with speech and language and information. The quicker we get that child to treat their middle ear problems or any permanent losses by providing them with the necessary hearing aids, then we're doing our jobs. Of course, there's stigma associated with hearing aids, and that happens all over the world. There's hearing aids that get prescribed, they cost thousands of reals and dollars, and they end up in drawers. And the reason why that happens is people think, you think I'm old, I need a hearing aid, I'm still okay. And because we associate hearing aids with being dumb, being old, and in reality, that's not the case. And the same way that we see children wearing glasses, adults wearing eyeglasses, older people wearing eyeglasses, the same thing applies to actually hearing aids. So being educated about that is everybody's responsibility. And I like hearing aid manufacturers that actually make them colored, to make them stand out, to make our children or older people say, this is who I am. We use headphones a lot for other purposes. Why not use them to make us feel and hear better and stay connected? Family, of course, challenges, because also when families seek help to find the right rehabilitation setup, the right school, it's a society's responsibility to provide better schooling, better specialized people to help them and support them in the process. If that child has other disabilities, that makes it even harder. So there's a lot of challenges ahead, and we hope that you enjoyed our talk and that you have some messages to go away with. Our job is to be aware of how to protect what we have and care for every member of our society and improve their life and productivity. Stay safe, and we'll see you soon.